Hello and welcome to Exercise Training, Safety and Self-Monitoring. My name is Kate. I'm an exercise physiologist in the Cardiopulmonary Rehab Department. I'd just like to review some safety considerations regarding home exercise. So when you are exercising, whether it's at home, at the gym, in your neighborhood, I encourage you to each and every time incorporate some lighter activity at the beginning of exercise. That's your warm-up. The warm-up allows your cardiovascular system to gradually change and adapt to better meet the blood flow demands of not only your muscles, but your heart muscle. Your blood vessels dilate to allow for better blood flow. They open up and expand to allow the blood to flow more freely to, again, those working muscles, including your heart. So your warm-up might look like a slower walk than you're about to, partake in by picking up the pace for your workout. It might be the lowest setting on your exercise machine and just a slow pedaling rate. It's really going through the motions at a lighter level for about 5 minutes to allow for that adjustment. And then once you're warmed up, you can go about your more intense exercise session, whether it's your aerobic exercise or your strength exercise. You might be doing both, but regardless of what your exercise session will look like, it is important that you spend some time warming up first. You may include stretching as part of your warm-up routine. You may include stretching after you've exercised, but really the purpose of stretching is to promote flexibility in your joints and muscles. It's best to do it when your muscles are a little bit warmed up, so you might do an active warm-up and some stretching, or you might put the stretching at the tail end of your exercise once you're done. It can help prevent muscle soreness, which often doesn't set in until the next day, to make you recover from exercise a little more quickly. But you can do it at any point during the exercise session. That's your preference. It is important at the end of exercise that you do spend some time cooling down. The cool down can look very similar to your warm-up. Again, at least 5 minutes of a lower level activity, which might include stretching. Really, the goal is to allow your cardiovascular system to gradually go back to its resting values. By moving, you're helping the blood continue to circulate. Since your blood vessels were dilated with exercise, that can lead to blood pooling in the extremities if you just stop exercising. So it is important that you keep moving to allow for that ideal blood flow back to the heart. Some safety things to consider. Your personal safety, of course, is the most important thing, whether you're exercising or not. So you might want to have your phone with you, carry your phone with you, or let someone know where you plan to go. If it's getting dark or if it's icy, exercising in a well-lit area is important. So, drivers can see you. You can see any icy patches. Bring any emergency medications you might use with you. Nitroglycerin, a rescue inhaler would be good examples of that. You want to dress appropriately for the weather. Footwear is very important. That's what's going to be providing your feet with the best support. So a good pair of shoes is important, but clothing that suits the weather is very important. In the summertime, your light-colored, loose-fitting, breathable clothes that will allow you to not overheat while exercising. In the wintertime, the goal is to maintain your body temperature, wearing layers, making sure that your sweat is not sitting right next to your skin. That's a quick way to really cool off too quickly and not maintain your body temperature. You'd want to have an outer layer that might block the wind if it's a windy day, but having a couple layers of clothing to keep you warm. Those are really the important pieces when exercising outside. You might need to consider what time of day is a good time for you to exercise. You should not exercise after a large meal. Typically about an hour is a reasonable amount of time to wait for a meal. If you eat a large meal, you might need to wait longer. If it's just a little snack, you could probably exercise in a shorter time frame, but you just don't want the food sitting in your stomach. And of course, taking advantage of the times of day that are maybe not as hot in the summer or not as cold and more sunny in the wintertime. It's important to avoid dehydration. That can be very dangerous. One of the best strategies I think people overlook with avoiding dehydration with exercise is actually beginning exercise adequately hydrated. So having maybe 16 ounces of water in the hour before you exercise would be a good way to get off to a good start. Don't overdo it. Again, you have that feeling of fullness in your stomach. It's not fun to exercise with water sloshing around in your stomach. So maybe a glass of water before you start, throughout the hour, and then throughout your exercise session, a few ounces, a few sips of water, maybe every 15, 20 minutes, and then have something to drink afterwards as well. You shouldn't wait till you feel thirsty. Often when we actually feel thirsty, we're already dehydrated. So that's important to avoid. I encourage water really is your best bet for keeping hydrated. You'd want to stay away from carbonated drinks because of the bubbles in your stomach. Stay away from caffeinated drinks just because they tend to increase your heart rate and blood pressure. And also sugary drinks, because many of us would not appreciate getting some exercise, burning some calories, with our weight management goals, only to drink the same number of calories, if not more, with something like a sports drink that do tend to be high in sugar. So water is really your best bet for your typical workout. A good way to monitor your exercise intensity is by taking your pulse. So in the picture here, you see that at the base of the thumb, you can use your 2 fingers to locate your pulse. There's an artery that's very close to the surface, close to the skin. That's pretty easy to feel. You also might find it on the side of your neck, your carotid artery. But once you find your pulse, you want to take a 10-second count of how many times you feel your pulse. And then you can multiply that number by 6. It's good to just take a little snapshot, just a 10-second count. Often we stop exercising to check our pulse, and the longer we count, the longer you're allowing your heart rate to slow down. So if you're taking a 15-second or even a 30-second count, your heart rate you're going to get a lower heart rate than is true during your exercise. So you might underestimate what your exercise heart rate is. And of course, know your target heart rate range. What are my exercise parameters? So if you're not familiar with those numbers, ask your cardiac and pulmonary rehab team at your next exercise visit. Monitoring for signs and symptoms of overexertion. So there is such a thing as too much of a good thing. To avoid overdoing it, we would want you to monitor your heart rate, your exertion, not exceed that target zone. If you're noticing that it takes longer than 5 or 10 minutes for your heart rate to recover, that might indicate that you've overdone it that day. So take it easy, maybe your next workout. If you're feeling very tired all the time, that could be a sign that you're progressing your exercise too quickly, doing too much. So just kind of tune in to your body for that type of sign. Anginal symptoms like pain, pressure, tightness, squeezing in your jaw, your back, your neck, your arm, typically in the left side, those are consistent with anginal symptoms. Experiencing that type of sensation would be a reason really to stop exercising and assess if it's resolving. Other unusual symptoms might be palpitations, a feeling like you're having extra heartbeats. If you're short of breath, you can't catch your breath. That's a little bit different than breathing heavier, which is normal during exercise. Being unable to catch your breath is not a good thing. So those would be cues to stop exercising. Dizziness or lightheadedness, also not normal. Make sure you're hydrated. If you're diabetic, check your blood sugar. Those would all be signs for you to not try to push through your exercise. Check and stop and evaluate how you're feeling. If those symptoms don't resolve, you should call 911. If your blood sugar is low, have some carbohydrate to resolve those symptoms. So thank you for tuning in to the presentation. I hope this has been helpful.